Garret Leahey is next. He is a business partner lead on Google's healthcare team. He provides digital marketing and advertising solution across Google's many platforms for pharmaceutical and consumer health companies. Prior to joining Google, Garret was an event manager for NBC's Olympic Hospitality Program and an account executive for NBC Universal and Telemundo. In fact, Garret's been to 4 Olympics and worked at 3, Athens, Torino, and Beijing. And he met his wife, who's the chief medical officer of Comcast, at the Olympics in Torino. Garret's talk today is entitled, I Am the Internet, How Personal Data is Fundamentally Changing Healthcare. Please join me in welcoming Garret to the stage.
Thank you. Thank you, Janet. Hi, everybody. This is a health conference. We've been sitting for, I think, 90 minutes. I think we should all get up for just, 30 seconds, stretch out, little break. All right. Talk to your neighbor. You've been awkwardly sitting next to them. You don't know their name yet. Okay. All right. Yeah, that's fine. I can make it up. All righty. Thank you. Let's not get carried away. I think there's a break in another 30 minutes or so. Okay, thank you all so much. So I'm on the healthcare team at Google. And one of my favorite things about being at Google on the healthcare team is I get to look at all those ridiculously gross queries that you guys do all day. No, I'm kidding. I actually I met my wife, and on the second date, she said the word stool, and I was in love immediately. So I'm into it. I love all the gross terms. All kidding aside, I love being sort of a student of healthcare change, and being at Google, I get to see how consumers are interacting with our platforms, how they're searching, how they're navigating the number of other platforms that Google has, their apps, YouTube, et cetera. And so the key theme, of course, of today and of the internet is rapid change. And so our behavior is absolutely changing in many different ways. And we're going to dig into that. And I think to put it into context, I want to show this hierarchy of needs. You all probably remember this from maybe Psych 101. This is Maslow's hierarchy of needs. And this was developed in the 1940s. And to be honest, I think this is all pretty much still correct. We still need food and shelter. We all want friends and love, and we all want a purpose. Do you think anything has really changed from our fundamental needs? Anybody? Anyone got an idea? Cell phone? Close. So yes, Wi-Fi. It's just basic. It's what we need. I mean, think about how Wi-Fi, of course, we lived for thousands of years without the internet. Fine. But it has really changed all of these things so quickly. Food, shelter, sleep. So shelter, how did I get here? I got here on using a map. How do we buy houses? Zillow, Airbnb. Economic stability, how do we pay our bills? Does anyone like using a checkbook? Does anyone still balance a checkbook, by the way? I know there's like 2 of you in the room. Friends, all of our friends now in some capacity are on social. Confidence, achievement, everyone loves getting their pictures liked. I mean, you don't really have an achievement unless you put at least a little bit online and share it with your family across the country. And then self-actualization, all the information gathering, all of the videos we watch, that all inspires us every day. That creates our purpose. So Wi-Fi is ubiquitous, the internet, the connectivity is ubiquitous, and it's changing pretty much every industry, including healthcare. And the big headline is now the internet has become the source for all health information, or the number one source, of course, not all information. And the reason that we turn to the internet, there are a number of different reasons, so I'm going to talk about a couple of them. The first is really just curiosity. We're curious beings, and we've had encyclopedias forever, and now we have Wikipedia. And that's really made it a lot easier to consume information, and it's fueling our curiosity. One example, the Ice Bucket Challenge from last year. Any Ice Bucket participants? There we go. Very nice. That's about half the room almost. Come on, be proud of that. That's great. So so we all are familiar with how successful this was. You've all probably seen a whole talk on it. But what you may not have seen is the interest associated with ALS itself generated in the form of search volume. So this is our Google Trends tool. It's a public tool. I recommend you play around with it if you haven't already been there. So this wasn't just about going to see your friends and celebrities pour buckets of water on their heads. It immediately triggered interest in the actual condition and led to an enormous amount of interest, 6,000% increase year on year in the actual condition itself. So we're curious beings, and this is fueling it in a way like no other time in history. In addition to just being curious, we're very concerned about what's going on in our bodies, and we turn to the internet for information to help us understand that. And so this is happening across the board. Pick a condition or a symptom, and you have millions, if not hundreds of millions of searches on all of them. And now, this is great. You get a lot more information, you get more informed, but it also leads, unfortunately, to a condition that many of us have experienced called cyberchondria. So we've all done it. We've gone to the internet. We have a headache, and 20 minutes later, you've seen a bunch of scary images. You're biting your nails and about to call your doctor. You think you have Ebola or something. That's an unfortunate side effect, but Google has made an effort to really remedy that. So this is a demo of what the current user experience is for searching for a health condition, in this case, tonsillitis. And we've really made an effort to give you the key information, the key symptoms, how prevalent it is, what are the main treatment options, so that our users can quickly get the most important information quickly and not necessarily go down a rabbit hole of really scary information. So we're doing our best to organize this information and really sort of alleviate these concerns when people are turning to the internet. So people are getting a lot more information, a lot smarter. And in addition to this curiosity and the concern, we also want to connect with others. We're very social beings, and now the internet has really changed how we can do that. So that's happening in a number of different ways, of course, in social media, Facebook, also on YouTube. Short of being face-to-face, video is that best way to really connect with another person. And patients are going on to video, onto social, to share their stories, to share their experience with different treatments. In this case, this is Holly, who's living through cystic fibrosis, and this is a 15-minute video that has 200,000 plus views on her experience going through it. And this has a real impact on everybody who's taking these videos in. People are making roughly 40% of people exposed to these types of patient videos on social are being influenced and really being aided in terms of how they want to proceed when it comes to their healthcare decisions. And so really what we have is curious, connected people, and it's created a real moment. It's lit a fire. We're thinking about all this information. We have really an empowered patient phenomenon. And then they're seeing what happens on Amazon, on Netflix, on Yelp. How frustrating is it when you go to Amazon and you're not logged in and you don't see all the things that you ever purchased and all the recommendations that they're sending to you because they really understand you? Netflix, how frustrating is it when you're not logged in, you don't know what to watch next? So now we want that out of health, and we're willing to connect everything to better understand our health. Really everything is connected now, from ourselves down to our dogs. We have about 5 billion connected devices. We know this is a major trend. But it's not just cell phones and wearables. By the way, I do have the Google Watch, and I guess I'm a glance hole. Is that what we're calling it? But it is having impact on behavior, so we'll talk about that now. So just leaving for work in the morning, any day now, we're going to be seeing a number of different sort of data opportunities. So from tracking your sleep, that's Beddit, to a smart toothbrush that's going to track how frequently you brush, how long you actually brush to make sure you're staying up with your habits. Vessel is the new beverage container that tracks the ingredients in your drinks, and so you'll always be able to be aware. And then Happy Fork, I think my wife is getting this from me. I eat way too fast, and this tracks, literally, if you're eating too quickly, it'll start vibrating. So, and of course, tracks everything else about your habits. So it's sort of every day-to-day functional object is going to be tracked, and then it's going to extend even further into our eyeballs. So many of you may have seen the news about Google X, our research lab creating the contact lens, which can measure your glucose levels. So it takes your tears, correlates it with glucose levels, and it's going to be brought to the market soon in partnership with Novartis. So we're going to be able to measure literally our tears. And it's going even deeper, from devices on us and around us to in our blood. Google is making an attempt, at least in the Google X lab. They're sending nanoparticles into your bloodstream, which are going to be attracted to a wearable device. And these particles are going to be essentially diagnosing you, finding potential cases of cancer. And really, our head of the life sciences group thinks that this type of approach with nanoparticles being sort of matched up to wearable devices are going to be a basic foundation for diagnostics moving forward. So what does this really mean? That means a whole lot more data. The latest estimate is that we're going to be a single person with these connected devices, wearable watches, all these basic devices that affect their lives, is going to lead to about 1 million gigabytes of data. So that equates to 300 million books, or 10 libraries of Congress, if you will. So it's really just an astronomical number that we can't even think about. So that's a huge opportunity. But what's more important is this early stage of the game of wearables has really demonstrated an impact. So about half of people that are tracking their fitness, and this is really early days, are making changes to their healthcare decisions, getting smarter about it. They're more informed, and they're adapting. And so what does this mean for all of us in the healthcare industry? Well, it means that really, the goalpost has moved. It's no longer solely just about the sort of efficacy of your medication. A recent stat we just came across is that payers and formulary decision makers, when looking at comparable drugs, comparable costs, and outcomes, are going to go with the medication that has patient support, platforms, connected devices, apps, etc. That's a game changer for everybody. But more importantly is it's not just going to be the companies that are participating now. The information's been democratized, and now Kenneth Shinozako, who has a grandfather with Alzheimer's, his grandfather wanders off sometimes, as about 60% of Alzheimer's patients do, and he's invented a device to track his grandfather. So he has the information and the technology now to invent this. He won the Google Science Fair this past year. And so the idea is the little sensor would be placed in a sock worn by the Alzheimer's patients, and as soon as they get up and potentially wander off, the smartphone is alerted, the caregiver is alerted. So incredible opportunity now with data, with technology, even for the individual level. By the way, I have no idea what happens when the patient goes to the bathroom. I think that's going to be something Kenneth has to work out. But so it's a really exciting opportunity. But this is just early days. Roughly half of the world, this is ubiquitous to us. That whole pyramid and how it's affected all of our lives it's unique to modern society, and it's about half of the world now that's connected. So what's going to happen is this exponential increase. Just in the next 3 years, about 80% of the world is going to have a smartphone in their hand, and that's going to lead to literally billions of more libraries of Congress out there of data that we can use to make smarter decisions, to connect dots. And so, what do we know now? We know that the consumer really wants an active role in their healthcare management. They're searching like crazy. They're getting the information they need. They're connecting with others online, and now they're willing to really connect everything in their lives to be smarter. And the technology is now there. Of course, it's still early, and it's going to get a lot better. But the initial reading is that it's actually working. 50% again, huge improvement. And lastly, so the businesses that are going to win are the ones that are going to be providing this personalized support. They're going to be tapping into the new technology and integrating it throughout the patient journey. So let's do it. The water's hot, as Lisa said. We've got to jump in. Thank you all very much.
Questions?
A lot of people are afraid of digital because of the side effects to issues. microphone since it's being recorded.
A lot of people in the pharma industry are afraid of the digital search environment because of the side effect issues or negative feedback. What do you guys think about that?
What sort of side effect issues specifically?
Well, anytime a patient comments on their condition and
Right.
an adverse effect, it has to be reported to the FDA.
Sure, yeah, okay.
So if
Literally
you're
side effects. I wasn't sure if you were talking about
this
another
is push
impact. Yeah.
versus pull. So if
Yeah.
they're bringing that in on their own to sites that they control, there's no problem. But
Right.
if pharma is trying to do anything to control that environment, they have to have a responsibility against it.
Right, no question. Huge issue, not an easy one whatsoever, but it's just one that needs to be addressed constantly. We are in communication with the FDA to make sure that they're fully versed in new technology capabilities, and really we have to push the envelope. There are companies that are doing it, and they're seeing success, and they're going through those hurdles. And so it's just something that needs to be done, despite the risk.
Had to be in the back corner.
Hi, Gary. I'm wondering, with the technology and the quantified self movement, and there's a segment of the population that's certainly there and wants that kind of stuff, and it's growing, as you point out. I'm wondering, in terms of how you guys think about the part of the population where they don't necessarily, either they're non-compliant and they're not part of the quantified self movement. And the idea that for a lot of patients, for example, who have a condition, that they maybe don't want that kind of technology because what that's doing really is simply reminding them that they have a condition that they'd prefer to not be reminded of. So I'm just wondering how that factors into your thinking as you guys are designing solutions and ideas.
You bring up a great point. Overall, the philosophy at Google is to get out of the way, let technology do the work for you, and improve your life. So, Google Now is an example of that. If those of you who aren't familiar, Google Now understands your calendar, what's in your Gmail, if you have a flight, where you work, and it immediately raises the information only when you need it before you actually need to proactively go search for it. It's meant to be sort of seamless and out of the way. So if the current technologies are such that some people are sort of frowning upon or alienated by it, the goal is to really change that and make better looking watches than this, I guess, that people are willing to wear, et cetera. We're testing it all, and that is the overall goal, to make it much easier and not make it a hurdle of any kind.
Just curious, you mentioned coming to market with the lens product in conjunction with Novartis. Is the plan to continue to take these technologies and partner with an individual pharmaceutical company to bring them to market, or at any point to maybe make them open source for everyone?
Great question, and one that I'm not an authority on. So far, we have a couple of pharma partnerships between our research lab, IIeX, and pharma. So there's one with AbbVie, as well as one with Novartis. But I think we've created a separate company called Calico that is standalone right now. It's focused on sort of increasing the life expectancy across the world. So it's hard to say. I think they're very open, and certainly the general philosophy of Google is to have open source and Android as it is, et cetera. But unclear. It's pretty early days for the healthcare ventures for Google.
Thank you.
Mm-hmm.
One more quick one.
You had mentioned patient support platforms that payers are looking at that. I'm wondering how that fits into the priorities that payers look at beyond clinical efficacy and the other
Right.
outcomes, the other things they look at.
Right. I'm sure there are many more people in the room that are greater authorities than I am on that. I think we were excited to see that as a data point to support our general philosophy that we have, which is that this technology can really improve things. So I don't necessarily know how that prioritization occurs firsthand, being in my role versus actually being on that side of the house. So I don't know, does anyone actually want to add to that? Maybe provide some context on if they think that payer stat may actually be pretty low versus some other more important things? I think that's a fair question, but I don't have an answer. Sorry.
Thank you.
Okay, thank you.